in the hospitals. This is a public health workforce down 80,000 jobs. We saw through this pandemic the challenges in sort of the volume of people who were doing public health work, but also where they were located and their experience. We need an upskilled public health workforce. For example, we need people to do those genomic sequences. We need genomic epidemiologists. We need people who are diverse as the communities they serve. We also need to make sure that they are compensated to have the right salaries and, as you say, have loan repayment for their work. To give folks a sense, the infectious disease physicians are among the lowest paying physicians in hospitals. They don't do procedures, and by virtue of not doing procedures, there's not a large incentive from a financial standpoint to continue to go into infectious diseases, which are the bread and butter of what outbreak investigation and clinical it does. There have been many resources that we're moving forward to expand our public health workforce. Public Health AmeriCorps is a big piece of that, and that is something that we're working on, and really grateful to resources from Congress to be able to do so. But there's a vital need now to expand our public health workforce in laboratory capacity, in genomic surveillance, in disease outbreak investigation, and a workforce that is upskilled and as diverse as the communities we serve. Thank you.
Thank you. We all know that vaccines remain the best way to protect yourself against existing variants of COVID-19, and I've been encouraged by the FDA's work to authorize vaccines for the public, but parents continue to be concerned that we don't have a vaccine for their kids as Omicron surges. Dr. Woodcock, can you provide an update on where we are in examination of the authorization of COVID-19 vaccines for children under 5?
Certainly. As Dr. Fauci said earlier, they were one of the companies, Pfizer, had done trials. There were other trials going on. There were probably complications with the dose in the slightly older of the younger children, perhaps indicating that a third dose, as Dr. Fauci said, might be needed to the primary regimen. FDA is working with the company very closely. Trials are ongoing. I, too, have heard from many, many parents of the youngest children. They have other children in school. They may have immunocompromised individuals in their household, and there are people who really want to get this vaccine. So
we back.
We are working very intensely on this right now, and we're working, of course, with NIH and with the companies.
With Pfizer.
I yield back.
Thank you. Senator Paul.
Dr. Fauci, it's disappointing for you to suggest that people who dare to question you are responsible somehow for violent threats. Realize that by attacking me, you're attacking the one member who actually has suffered from violent attacks. I was at the ball field today. Steve Scalise almost died. I was 10 feet away from a staffer who was shot in the leg. We had over 160 rounds of semi-automatic weapons fired at us, ammunition. So for you to somehow suggest that somehow I or people who dare to oppose you are responsible for threats, that's insulting. The person who shot at us and almost killed Steve Scalise was a rabid supporter of Bernie Sanders. But the one thing you'll find if you look at the record is that not one of us accused Bernie Sanders of being responsible for that. So this is the kind of ignorant sort of personal attacks that you've engaged in. You engaged in these attacks with fellow scientists. Not only was it 3 scientists from Harvard, Oxford, and Stanford that you chose to malign, 50,000 scientists and medical doctors signed this petition. And what they wanted was something that most Americans think is pretty reasonable. It's a different kind of approach. Instead of saying that everyone is the same and everyone should get the same treatment and everybody ought to just get vaccinated, what it did is it said that the death rate for this disease is extraordinary in the risk being different according to ages. So if you look at an 80-year-old, it's at least 1,000 times greater death rate than it is for a 10-year-old. So wouldn't we want to say that, well, we're going to assess the risks of each individual and have the treatment according to that, or would we just simply say everyone should be vaccinated? The death rate for kids under 18 is about 1 in a million. A little bit less than the chance of being struck by lightning. We don't yet know fully whether or not kids who have already had COVID might be at risk for some of the side effects of the vaccine. Still needs to be explored. But for a kid under 18 who's already had COVID, see, it's a death rate of about 1 in a million, even if you haven't had a disease, even if you haven't had COVID, it's about 1 in a million. It's extraordinarily uncommon for a child to die. If you've already had the disease, it's probably a great deal less than that. Many Americans wonder why you've steadfastly refused and worked with others to try to hide any kind of knowledge of natural immunity and how it would affect our decision making. So for example, you have a 10-year-old kid and his mom comes up and all of a sudden he gets myocarditis from the vaccine and dies. Admittedly a rare complication, but what are you going to tell her when she says, well, he had COVID 3 months ago? I mean, why would you force me to vaccinate my kid? Why would you force me to vaccinate my kid without even checking to see whether he's already immune? Now, the idea of natural immunity is the idea upon which vaccines are based. We've believed, and all of medicine is based on the idea of acquiring natural immunity. People often respond and say, but you don't know how long it'll last. Well, we don't know how long vaccines will last either, and that doesn't make us anti-vaccine. We do know that the vaccines are waning very quickly in potency. We do know that the vaccine against Omicron really isn't preventing transmission. You've noticed that the debate has shifted, and the debate is now talking about trying to prevent hospitalizations and death. And I agree with those statistics. I think it's a good idea if you're at risk to be vaccinated. I've always been pro-vaccine. I'm just simply against authoritarianism and against mandates. The anger that's developed with you, Dr. Fauci, is that you don't want to give us advice. You want to tell us what to do. You think you are the science, and that anybody responds to you, how dare you? How dare you criticize science? As if you somehow are science. That kind of arrogance, that hubris is really, that's where the anger's coming towards you. If you were one doctor among hundreds of doctors in the government who gave advice, I don't think anybody, people might object to your advice, but there wouldn't be such a degree of anger. But you are so certain that you're right that you're not willing to hear anyone else. 3 epidemiologists, of which you are not even an epidemiologist, but 3 epidemiologists prominent in their field, Oxford, Stanford, and Harvard. You maligned them. You spoke openly with Dr. Collins, and you did not disagree that let's paint them as fringe. You went after them and said, we will do a public takedown, not in Science or Nature or Lancet, in Wired, in The Nation, a left-wing publication. You've engaged in base politics. You wonder why there's so much anger? You're not an objective scientist. You've lost that long ago. And so many of the things that people want, it's like they want to know why you're forcing their children to be vaccinated when 95% of people at risk have been vaccinated. Over 95% of people over 65, it's a huge voluntary success. And yet you won't rest until you force every child to get this. So yes, there's a great
Senator
deal
Paul,
of
your time has
dissatisfaction with
expired.
you, and many people want you to go, but nobody wishes you violence.
Senator Paul, your time has expired. I will use 1 time of my remaining 5 minutes to allow Senator Fauci to respond.
Thank you very much.
Dr. Fauci,
Yeah.
sorry.
Thank you, Dr. Murray.
No.
So, first of all, Senator, again, at a hearing such as this, where there are almost 900,000 people in this country have died from this outbreak, you have chosen to just personal attacks on me that go back to multiple hearings. And again, just for the record for people to check, I have never said take people down in that email. It was an email that was sent to me. See, and again,
You agreed with Dr. Collins in the email.
Senator Paul, this is my time.
you know, you personally attack me, and the things that you do are incorrect and proven incorrect. You've publicly accused me at a hearing of being responsible for the death of 5 million people, when there is not a single shred of evidence that anything that was done with the NIH had anything to do with COVID-19. You talk about things like gain of function.
Dr. Fauci, I'm going to let you respond continually, but I think you have responded, and I appreciate
Okay,
your
I
response
appreciate the
very much.
time. Thank you very much, Madam Chair, but I just want to say, I'm actually stunned by the amount of misinformation. The only thing I have ever done, and this will take 20 seconds, if you look at the things I've said, they've been to support the recommendations of the CDC, of their advisory committees, and of the FDA. I've told people that it's important to get vaccinated, to get boosted, to wear a mask.
What about
and to be
therapeutics?
prudent. That's the only thing I've said. I haven't dictated anything that's only a monolith with me. It's always public health practices. And anybody goes back over any record of me, they know that.
Thank you, and I will retain the balance of my time. Thank you very much. Senator Casey.
Thank you, Chair Murray. I want to start with Dr. Walensky. Doctor, as you know, the CDC has been working with my staff on an outstanding nursing home vaccine data request. I would appreciate it if you and your team would continue to work with me and with our team at the Aging Committee to resolve this matter.
Yes, thank you, Senator. I'm aware of that matter, and we are committed to continuing to that work with you.
Trying to
Thank
find where the,
Let me turn to a matter for Health and Human Services. Assistant Secretary O'Connell, you know that our nation's long-term care facilities were ground zero during the
to
first
process
year of
what's actually
COVID-19.
happening right now, which is
200,000
most
residents
people
and
are going to
workers,
get
and you add up the
COVID.
number of residents
All right, and what we
plus
need
the
to
number
do
of
is make sure the
workers
hospitals
who
can still
died,
function,
it gets to 200,000 over
transportation,
these 2
you know,
years.
other essential services
nursing home
are not
deaths have
disrupted while this happens.
declined dramatically thanks to the safety and effectiveness of the vaccines. It's a credit to the administration that 90% of nursing home residents and 80% of workers have been vaccinated. We know that infections are on the rise right now, though, in nursing homes, raising safety concerns and putting additional pressures on workers who have been stretched thin. For instance, we know the pandemic has worsened existing staffing shortages and turnover issues. So we also know at the same time that the rescue plan that Democrats passed in March helps to fill the staffing gap with a $500 million initiative for strike teams based upon legislation that I was leading recently. These strike teams provide medical personnel and other supports that help nursing homes get through the surges like the one that we're seeing right now. On the 22nd of December of last year, I, along with 3 of my colleagues, sent a letter to Secretary Becerra asking how Health and Human Services was protecting nursing home residents and workers in the current COVID-19 surge, including the distribution of booster shots. What is HHS doing to ensure
As a gun
nursing
owner,
homes have
you
the
need to know how to
supports they need to protect residents and workers who care for those residents?
this is over.
Senator Casey, thank you so much for your question. We share your concern for nursing home staff and long-term care facility residents and have continued to do all we can to make sure they have access to boosts. We've worked with pharmacies to bring in vaccination clinics, bring those to the long-term care facilities and skilled nursing facilities. So the vaccines are available on the ground and the residents don't have to travel or access the vaccines on their own. In addition, ASPR has been sending since the beginning of the pandemic, or since the beginning that these tests were available, 2.8 million tests per week to long-term care facilities across the country. We know how important it is that
Fuck with this bitch talking about.
Thank you, Senator. We do, from my vantage point in the National Security Division, we have resources to carry out our priority missions. Obviously, January 6th is a singular event that is stretching the resources of our office and the U.S. Attorney's Office in D.C., which is handling that case. There are a number of people have been detailed around the country to support that process.
Do you need more money, any changes in the law to do your job?
At this stage, I don't have any requests for more money or more authority, Senator. Thank you.
Thank you. The Vice President equated January 6th with Pearl Harbor and 9/11. Do you agree with that?
In my view, and if I may just begin by saying, with Senator Durbin and Ranking Member Grassley, it was a day that must have been horrific to be directly involved in or be victimized on Capitol Hill, and I do think it was a singular event. I'm reluctant to compare it to any prior events in our history because, from my vantage point, it was unique and singular.
Yeah. So the courthouse in Portland was attacked 100 nights in a row. Would you consider those people a candidate for domestic terrorism charges?
I know that hundreds of people have been arrested, as we've discussed this morning. I don't have any information about whether or not in any particular case they would be, subject
Well,
to.
Senator Hirano said that people use violence for whatever purpose. To attack a courthouse for 100 nights in a row, how many people have been charged with the Portland incident, do you know?
I defer to Ms. Sanborn that it had data on the number
Ms.
of arrests.
Sanborn?
I don't know the number of
Do you know, Ms. Sanborn?
No, sir, I don't have Portland specifically in front of me. I would, what I was referring to is 250 arrests over this whole summer.
Well, here's my point. January 6th was a bad day. It was a terrible day, and people are being prosecuted.
Nah, not yet. They just started coming back. I just wanted to see.
Filed the Capitol, but these protests went on.
I'll tap in back with these fuckers for a second. I just want to see what the domestic terrorism fucking hearing said earlier.
And I didn't hear a whole lot from my colleagues on the other side for an entire year. I guess that's what gets me more than anything else. I understand the scope of January 6th, and I hope people are brought to justice. But this is, it's got to be a two-way street. Let's talk about the world in which we live in now that we have a very brief time to do so. The fall of Afghanistan, the takeover of Afghanistan by the Taliban, has that created additional national security threats to our homeland?
Yes.
Leaders.
Nobody's been charged with that. They've been charged with other things, not that one. On June 7th of 2021, I signed on to a letter with a bunch of my colleagues. The letter was led by Senator Johnson, and or either
Very
fundamental statement before
Protected by the First Amendment. It also talk about
have been charged with crimes of violence. Whispering to a person, and
This shit was hilarious.
5 seconds after he's whispering to a person,
Who the hell is that? Raps FBI? I don't know.
urged them to tear down the barricades.
Sir, similar to the other answers, I cannot answer that.
Why does every FBI chick look like a dude?
Listing, seeking information on individuals connected with violent crimes on January 6th. Among those individuals, at the bottom there is Mr. F. The
Oh,
FBI
Ray
asked
Epps.
for information, identifying
Hector Babito was in this shit. I don't know about this picture, but
This was posted, and then sometime later,
I wonder where is Hector Babito?
Mr. Epps disappeared from the public posting. According to public records, Mr. Epps has not been charged with anything. No one's explained why a person videoed urging people to go to the Capitol, a person whose conduct was so suspect the crowd believed he was a Fed, would magically disappear from the list of
Fed,
people the
Fed,
FBI
Fed.
was looking at. Ms. Sandburn, a lot of Americans are concerned that the federal government deliberately encouraged illegal and violent conduct on January 6th. My question to you, and this is not an ordinary law enforcement question, this is a question of public accountability. Did federal agents or those in service of federal agent actively encourage violent and criminal conduct on January 6th?
Yes.
Not to my knowledge, sir.
Fucking liar.
Domestic housing guidance. It is.
I just flipped to the cover of my binder here. It says the title of this hearing is the domestic terrorism threat 1 year after January 6th. The Attorney General has repeatedly said this is one of the department's highest priority. You're testifying at a hearing about the domestic terrorism threat 1 year after January 6th, and you can't answer questions about how many people have been charged for events arising out of January 6th. Would you go into a briefing with the Attorney General, your boss, and not be able to answer such basic questions?
On the last question you asked, Senator, over 700 people have been charged in connection with January 6th. About 325 have been charged with serious felonies in connection with attacks on.
10 minutes ago, Senator Cruz asked you this series of questions, and you didn't have the answer. You didn't have the answer for how many people have been charged with violent offenses or nonviolent offenses, and so on and so forth. Have you been given the answer in the last 10 minutes?
I'm sorry if I misunderstood, Senator, but I believe that Senator Cruz was asking me about other events, not the January 6th event.
Okay, let's turn to another issue that came up earlier today. Ray Epps. During the January 6th riots last year, Mr. Epps was caught on video several times.
Yes, he was.
To encourage
Fed.
people to enter the Capitol, to break down police barriers. Video from the rallies, or from the rally down the National Mall earlier today shows him doing the same thing. Video even from the night before shows him encouraging people to enter the Capitol. Ray Epps lives in Arizona. He didn't exactly go underground after January 6th. He even gave an interview to local media, and he was well known to the Department of Justice. He was on the FBI's Capitol Riot Most Wanted page just days after January 6th. In fact, he was one of the first 16 suspects added to that Most Wanted page on your website. It does not appear that he's been arrested or charged in any offense. In July, without explanation, he was removed from the FBI's Most Wanted page. Mr. Olson, who is Ray Epps? And why was he removed from the FBI's Most Wanted list?
Senator, I don't have any information about that individual. I would defer to Ms. Sanborn for any additional.
Okay, so this is, it gets back to what I meant earlier, like asking if you're prepared for this hearing.
No, he's not prepared.
You're the Assistant Attorney General for National Security. You run the National Security Division. The department has said that these January 6th prosecutions are one of their highest priorities. This is a man who was on the Most Wanted page for 6 months. Do you really expect us to believe that you've never heard of the name Ray Epps? You don't know anything about him?
Trompito.
I simply don't have any information at all, Senator, about that individual.
Liar.
What other suspects?
Lying under oath. Hold that bitch accountable.
Senator,
let me ask you: Can you name anyone else on? Can you name anyone else on the Department of Justice's Most Wanted page?
I'm sorry. I'm sorry. I didn't hear your question.
Can you name anyone else on the Department of Justice's Most Wanted page from the January?
I'm not familiar with the Most Wanted page. No, I'm not familiar with that.
Wow, you're national security.
Elsewhere, but this has not been a stellar performance today.
Senator Whitehouse, are you online?
I am.
Please proceed.
Dual option.
That track goes.
By White and Senator.
Full-time, part-time on that case.
How many personnel in your division are working on issues pertaining to Attorney General?
Senator Hawley be coming with the heat.
2021 that's entitled Partnership Among Federal, State, Local, Tribal, and Territorial Law Enforcement to Address Threats Against School Administrators, Board Members, Teachers, and Staff.
Senator, and with regard to that memo and that work, the National Security Division plays an informal advisory role. There's no one that's dedicated to that.
Should be called no such division is what they fucking.
I think we're available to consult with if the facts warrant, that level of consultation with the National Security Division.
And what exactly are you, what have you done to date with regard to, this is the school board memo, just for those who are following along here. What is it that your division has done to date so far with regard to that memorandum and the department's effort here to track parents at school board meetings?
With regard to the school board memo, which again I understand is an effort to protect school board members, other public servants, teachers from acts of violence or threats of violence, but from the perspective of the National Security Division, I don't think we've had any particular role or done anything particular with regard to that effort.
So you're not coordinating with local officials?
Again, I'm aware, Senator, that the National Security Division has played any role in any matter up to this date. And I've been in the role for 2.5 months, but I've not heard of anyone in my division having any role to play there yet.
You responded to some questions from Senator Whitehouse just a moment ago about parents at school board meetings. The gist of the questions was it doesn't really matter if it's a school board meeting or elsewhere. If you commit acts of terrorism anywhere, then it's terrorism. Is it your view that parents speaking out at school board meetings can be or are domestic terrorism?
Absolutely not.
All right, cool, because I speak at that bitch. I tell you, go fucking put rocks.
On this is that for that matter, law enforcement officers or other public officials from threats of violence, criminal act violence. My understanding of Senator Whitehouse's question was really just about the location of various federal crimes, not necessarily domestic terrorism, but just federal crimes is largely being beside the point when it comes to federal law enforcement.
Are Department of Justice officials and prosecutors still drawing up lists of crimes for which parents can be prosecuted regarding their participation in school board meetings?
I'm not aware that that's ever happened.
Really? You're not aware that it's ever happened? Did you watch the Attorney General's testimony before this committee when he was here last, when we read to him into the record a list of crimes that Department of Justice prosecutors, employees had prepared, had sent to local officials talking about crimes that parents could potentially be charged with? A list which, by the way, was incorrect, listed crimes that don't exist, but that had been sent to local partners in at least one state, all of the local partners in one state. Are you familiar with that, with his testimony in that regard? Did you watch that hearing?
I am generally familiar with the Attorney General's testimony, and again, my understanding of both his testimony and his direction for the Department of Justice is to take the necessary steps that we can take, whether it's enforcing federal law or working with state and local partners to protect individuals who both are serving in public service roles such as school board members and teachers, and to protect First Amendment rights of people who attend or speak at school board or other public.
Well, here's my issue with that, is that what we have found consistently out of the Department of Justice is we can't get a straight answer as to why your division would be involved at all with regard to school board meetings, why the Attorney General told us you wouldn't be whatsoever. It appears from subsequent reporting that you have been. We were told that parents wouldn't be charged with federal crimes, and we know that Department of Justice prosecutors have drawn up lists of federal crimes and disseminated them to local partners. The Attorney General told us that hadn't happened. We now know from whistleblowers that it has happened, and we can't get a straight answer as to why parents should ever be treated or regarded as domestic terrorists. I've got other questions I'd like to ask you with regard to January 6th. My time has expired, so I'll give those to you for the record, and I'll have some additional questions for you regarding your division's involvement or not with what the Attorney General is doing with regard to school boards. Thank you, Mr. Chairman.
Thank you, Senator Hawley. I believe Senator Booker is virtually available.
Yes, Mr. Chairman.
Senator Booker, take it away.
Yes. First and foremost, I think your call to members on both sides of this committee is important, and unfortunately,
skip this bastard.
Look at the
Mr. Opposed to violence, whatever the source.
All right, well, I guess they're not talking anymore.
Hyundai Tucson versus Toyota RAV4. Look what Tucson has and what
requirements.
Well, you're still not answering my question on the amount of money that was used to deal with the crisis at the southern border. So I will tell you that our staff's investigation found that $850 million out of the testing budget and another $850 million out of the allocation for the stockpile were instead used to deal with the crisis at the southern border. Do those numbers sound right to you?
Senator, I'll be happy to take that back and discuss that with our finance team to make sure that those numbers are the same numbers that they're tracking.
Well, I have to say that it's interesting to me that you knew all of the numbers, and I commend you for this, that were going to community programs, to schools, et cetera, but you can't tell me how much was reallocated to deal with the crisis at the southern border, a crisis that, were it brought under control, we would have these funds for the purposes that they were intended. Let me ask you further. What do you mean when you say mitigation as applied to the southern border and the surge, the unprecedented surge of people crossing?
Thank you. One of the important things that we needed to do when we identified a COVID-positive unaccompanied child was to make sure, for example, they didn't ride on the same bus to a shelter with a COVID-negative child. So there were additional costs for transportation to keep the children separate, to mitigate spread, as the statute allowed us to spend those funds. In addition, within the shelters, it was necessary to set up a separate room where COVID-positive unaccompanied children would reside, so they wouldn't interact with the COVID-negative children, and that required additional additional resources in those shelters in order to keep them separate. So when the children entered the community with their sponsors, they were not bringing COVID into the communities.
Well, I will tell you, having visited the southern border in late March, testing was being done, but people had been there.
Yeah, this lady got like some cerebral palsy.
With no testing.
That's why I didn't want to make a joke, though.
There were people, adults, who were released.
If the Bills make the Super Bowl, hopefully crypto fucking boom so I can have the money to pay for that bitch. If not, I'm fucking sitting on my ass.
Southern border under
But the game, I think, is in LA, right? I saw an article that LA and the NFL was going to change the Super Bowl to
we would be using the money.
They were going to change the Super Bowl to like somewhere in a red state where there's no vaccine mandates and shit, because can't throw a party if you have too many rules.
A problem that has contributed to the shortage of testing, the uncontrolled crisis at the border, and I also am perplexed by the lack of federal orders for tests between January and September of 2021, which I know from my experience in Maine caused a major manufacturer, Abbott, to lay off 400 workers that were producing those tests because it lacked the federal orders. That makes no sense to me and seems very short-sighted. Thank you.
Thank you, Senator. Senator Hickenlooper.
Great. Thank you, Madam Chair. And again, thank each of you for your public service. Dr. Walensky, I wanted to talk to you just for a moment about genomic sequencing. Even before COVID-19 appeared, Colorado made a genomic sequencing of diseases a high priority, and we're now, I think, one of the leading states in detecting changes as they evolve in COVID-19. We test about 15% of all still one of the
that's the thing, though, is that
and we also monitor wastewater. And,
I could go tailgate over there.
Detection. So, Dr. Walensky, how
But my schedule has to align with Danielle's.
we expand genomics surveillance and expand those capabilities in order to try to stay ahead of existing but also future threats, COVID-19 or otherwise? How do we close the gap between the states that are heavily sequencing and following this and those that aren't?
Yes, thank you for that and for your leadership in Colorado in genomic sequencing. As I've mentioned, we need to have both numbers and breadth and geographic distribution in order to get a real good view of what's happening in genomic sequencing. So we need to sample from state labs, so we get samples from every single lab. We also get samples from commercial labs, which gives us a lot of volume. We have partnerships now with 19, I believe, academic medical centers in order to do so. And what we do and power our genomic sequencing is so that we are able to detect a sequence that's present at less than 0.1%. So we scale up, and based on the number of cases that we have, we scale up or scale down our genomic genomic sequencing so we can detect it. And what we were able to do with Omicron is when we saw the footprint of the S gene target failure in PCRs, a similar footprint as alpha, we were able to do targeted enhanced surveillance of sequences that actually had that initial footprint and able to identify sequences even before they reached that 0.1% threshold. So as you said, we can scale this up in wastewater. We're able to potentially scale it up for purposes of antimicrobial resistance, for foodborne outbreaks and many other things, which we're really looking forward to doing now that we've established this incredible capacity.
Right, great, that's perfect. Ms. O'Connell, I want to ask you a question in terms of we've talked a lot about the distribution of tests and whether it's schools.
The dates don't come out, I think, until
we
like
talked about how at this moment we don't
June
have
or
enough
July.
tests out there. And
I'm
we're
pretty
not
sure, or
getting
May.
results quickly enough.
May, June, or July. Because I know you can start buying
In terms of the
tickets and shit that
distribution
early,
of
but
tests, on a national level.
that's why I didn't want to buy any tickets last year, because I didn't know what this fucking COVID shit. If you
I know the administration's hard at work on this. But some states like Colorado already have systems in place where tests are being mailed directly to people in their home. And I guess I don't know, is the federal government working with states like Colorado and trying to look at those systems already in place, and how do we integrate the federal system with those states?
Absolutely. Thank you, Senator. That's terrific what Colorado's doing. We have invested $29 billion with the state so they could set up such testing programs however they saw fit. And we are seeing states like Colorado use those funds to be able to do exactly what we're hoping to do on a national level. We are in the process, as we've talked about today, setting this up, working with the U.S. Postal Service. As the federal government, we will allow American households to order and have them delivered to their house as well. I imagine that we will.
Yeah, the one you was talking about, Chicago, that would be kind of dope.
Colorado is able to provide, and we want to have as many
Blackhawks
tests
game
available to all
and
Americans.
a Bears
as
game or
possible.
something.
Colorado's already doing it. That's terrific.
Or you bring your bitch ass to fucking Miami,
Experiences you've had in your state.
watch a Florida Panthers game and a fucking Bills Miami game. Show you how we do it in Miami in the Trio 5.
We've heard from
You stay in my house. That's what I told Alex.
integrate the aggregation of large amounts of data.
We should be moving back by June. At the no later.
Israel versus South Africa. It really is a question of how do we take, my question is how do we take information from global sources and, learn from those countries who are ahead of us on the curve, make sure that we're learning from their experiences. And I think how can we do a better job working with our international partners to make sure that we are prepared for the next Greek letter.
Yeah, well, thank you very much. Excellent question, and we are just actually doing that. Every week to 10 days, I have a long phone call.
Yeah, you ain't been to Buffalo yet, too.
And Patrick Valens, who are the two leading medical and scientific advisors to the
I just want all this shit to be over and
to get a feel
fucking
what's going on there. We have
give us the opportunity to just live life. No fucking rules and shit, because these fucking rat bastards controlling everybody. In China! Fucking China!
literally constant communication with them.
Thank you.
Thank
Go
you.
back.
Senator Marshall?
The American people, my family, all of our families are struggling as this pandemic continues to drag on with no end in sight. The words I hear every day, multiple times each day, continue to resonate and echo in my mind as I sit here. Words like I'm tired, confused, burnout, scared, and frustrated. The list goes on. But what's making the situation worse are the officials leading our nation's COVID response going on national television and contradicting each other. And of course, some Supreme Court justices are spreading misinformation as well.
Ooh, Supreme Court justice.
You recommended asymptomatic people be able to return to work after 5 days. But Dr. Fauci ambiguously corrected you on national television and suggested folks needed a test before return. How does that make you feel when Dr. Fauci or someone like Justice Sotomayor upstages a previous statement or policies of yours blatantly contradicts and undermines your guidance or offers false claims that cause more confusion for the American people.
Thank you, Senator. I have the great honor of leading the agency of 12,000 public health servants in this country, and we work collaboratively with tens of thousands of public health officials around the country to provide guidance. I also get to work with a COVID-19 task force that is full of a multidisciplinary group of people with diverse expertise from immunology to drug regulation to epidemiology. This science is moving really quickly, and I know you will appreciate that it's moving fast and it is changing, and it is our responsibility.
Well, you got two masks
to
on.
convey that science.
So I'll move on. The FDA has recently set up protocols for monoclonal antibodies and antiviral pharmaceuticals to be prioritized based upon race. Dr. Woodcock, has the CDC or FDA done a multiple regression analysis on race to see if indeed it's an independent factor for increased morbidity and mortality? And if it hasn't, don't you think zip code would actually be more predictive? Wouldn't it make sense to prioritize these antivirals and testing, for that matter, to senior citizens and those with significant comorbidities, regardless of race, especially if the multiple regression analysis proves my opinion? Dr. Woodcock?
What FDA did was to recommend that people at high risk would be candidates for these products.
Did you do a multi-regression analysis on this independent factor?
That's what I'm saying.
We did not.
Okay.
We did not. We don't make those kind of recommendations. We make.
But you can do studies, right? The FDA and CDC can do studies to see if it's truly an independent factor, or if not, truly the issue should be about your comorbidities and your age. So, Dr. Fauci, according to Forbes, you have an annual salary in 2020 was $434,000. You oversee over $5 billion in federal research grants. As the highest paid employee in the entire federal government, yes or no, would you be willing to submit to Congress and the public a financial disclosure that includes your past and current investments? After all, your colleague, Dr. Walensky, and every member of Congress submits a financial disclosure that includes their investments.
I don't understand why you're asking me that question. My financial disclosure is public knowledge and has been so for the last 37 years or so, 35 years that I've been
The
director.
big tech giants are doing an incredible job of keeping it from being public. We'll continue to look for it. Where would we find it?
All you have to do is ask for it. You're so misinformed, it's extraordinary.
Why am
All you have to
I
do is ask for it.
misinformed? This is a huge issue. Wouldn't you agree with me that you see things before members of Congress would see them, so that there's an air of appearance that maybe some shenanigans are going on? You know, I don't think that's. I assume that that's not the case.
What are you talking
it's
about?
Not the case.
My financial disclosures are public knowledge and have been so. You are getting amazingly wrong information.
So I cannot find them. Our office cannot find them. Where would they be if they're public knowledge? Where?
It is totally accessible to you if you want it.
For the public. Is it accessible to the public?
To the public.
Great. We look forward
You
to
are
reviewing.
Totally incorrect.
Well, we look forward to reviewing it.
Senator Marshall, Dr. Fauci has answered you. It is public information, and he's happy to give it to you if you would ask. Senator Moran.
Chairwoman, thank you. I know this has been talked about. I've watched a bit of the hearing from my office this morning and into this afternoon, but would you highlight for me, I suppose this is for Dr. Woodcock, lots of funding.
Who said that?
I think adequate funding. Certainly knowledge about winter months would bring an increase in cases. What's the challenge in not being better prepared for access to testing in-home and elsewhere? And how soon will that change?
I don't think that's, I think that's a question for Assistant Secretary McConnell, but I would tell you FDA has approved or authorized over 400 tests or collection systems just for COVID. We've authorized 15 over-the-counter tests, but it's capacity that we're talking about here, production capacity.
So there's no, what you were telling me, Dr. Woodcock, is there's no problem with the FDA approval of tests. It's the manufacturing process and the supply chain.
We could do more with more resources. We have authorized over 2,000 different device products, including the 400 test-related products in 2 years. So that's an incredible increase in the workload, and we really appreciate the funding that Congress has provided. However, the test manufacturers, many of them give us incomplete results. We have to go back and forth with them. The ITAP program that we are doing with NIH for home testing, I think will improve that tremendously. That's a big advance forward. But there's also the matter of production capacity with this huge surge and so many more people becoming infected.
Is there a separate FDA results process in which the test is read and determined positive or negative? There's no challenges there in that process?
That's what the ITAP program over at NIH is doing. They're actually doing the laboratory and clinical testing for the manufacturers, and then they send us the data. And so it's standardized and it's a panel, and that really accelerates our ability to get these authorized very quickly. As I said earlier, we've authorized them within 2 days of getting the data from the ITAP program. So that's a tremendous setup that I think is really beneficial, where we have standardized testing by scientists in the government, and that enables the manufacturers to get their products through very fast.
Thank you. Ms. O'Connell?
Thank you, Senator. And just to pick up where Dr. Woodcock left off, once those tests are authorized, ASPR reaches out to the manufacturers to make sure that we're optimizing the manufacturing capability. So that part is sort of a seamless process that we have. But all of the work we're doing in testing in this administration is in service of 4 priorities. 1, to expand the number of testing sites that are available. 2, to expand the number of tests that are available. That's the part that I'm working on, to increase capacity. 3, the kinds of tests that are available. That's the part Dr. Woodcock just discussed. And then to help lower the cost of tests.
Can I use a computer, please?
And is there a problem? I don't know whether the testing devices are manufactured domestically. Do we have another challenge of the importation of tests, as we did with masks and gowns and gloves?
What do you want me to help you?
We continue to look for tests wherever we can find them. And we have encouraged actually some test manufacturers that are approved in Europe to apply for FDA approval here in the United States.
How's that weird?
So I do anticipate we will have some importation of tests at
People
some
watch,
point.
people
But we've
play
used
video
the Defense
games.
Production Act authorities 12 times to support the domestic manufacture of tests and to prioritize.
How else are you supposed to stream something
those
that people
orders
are
so we
watching?
can
How else
increase
people
the
do podcasts?
supplies and manufacturing capacity here in the U.S.
In the third of a minute that I have left,
Right, until you become
we've changed,
inside
I
the game,
think,
and
our
then
view on
people watch me.
masks recently, and we're emphasizing N95s. Is there any intentions to, is there a plan to manufacture additional 95 masks so they're more available? Is there a way to make them more comfortable? I'll leave that. That's the crux to my question.
Here.
We continue to support the manufacture of N95 masks. We have $737 million in the Strategic National Stockpile, all sourced from 12 domestic manufacturers. So we're continuing to support that. We are also in the process of putting out an agreement for warrant-based manufacturing. So we're able to keep this capacity that we currently have going, even when demand diminishes. So that's all underway right now. As far as fit and style and how they work, I'm sure colleagues at the table are probably have various pieces of their programs that might be participating to that effort and consulting with the manufacturers on how that will work.
Thank you.
Thank you.
Move to Senator Tuberville.
Thank you very much. Just very quickly, I know there's plenty of misinformation on both sides. When it comes to COVID.
Is it going to
but
show when I'm
would
Google
say
searching?
This, the fear mongering on the left is, and
Why
I'll
are
give
you
a
using
couple
that
of
one?
questions here about
I
this.
don't know. I
It's
don't know what
made
to
the matters
use.
much worse. Dr. Fauci, I just want to ask you this from my constituents back in Alabama.
Here.
Ivermectin,
Different, bro.
40-year drug.
You look like an
My
illiterate.
constituents read once they hear about it and all this. 40-year drug. They call it a wonder
The
drug.
number
It's about
4.
a nickel a tablet.
Yeah, fucking Google searches that.
It's done wonders supposedly in India, several other places. And then you have this new antiviral pill that we're coming out. And my constituents
The
saying,
4
"This ain't
on
gonna
a
cost
jersey, is it this
$500,
kind of
each."
4 or is it this 4?
Could you give me a rundown on between the
Is it
difference
this
in those
4
two?
or this
What you
4
think
on a
about them?
jersey, on a
Get it
basketball
on record
jersey?
here so I can tell my people back home, this is what Dr. Fauci says.
Sure. So Paxlovid, the drug from Pfizer, has shown in a randomized placebo-controlled trial to be
For
highly
basketball.
effective to the point of 89%, almost 90%.
Basketball right there.
What's it called?
Down below.
Paxlovid.
Okay, left.
It's made by
I
Pfizer.
see it. Thanks, babe.
And has been shown in a very well-controlled, randomized placebo-controlled trial that if you take that drug compared to the placebo within the first 3 to 5 days, within the first 3 days, you have about an 89% chance of preventing you from going to the hospital or dying. There were no deaths in the Paxlovid group, and there were several deaths in the placebo group. That's Paxlovid. Ivermectin has had non-controlled trials suggesting that it might be effective, mostly anecdotal. The CDC,
What am I
excuse me,
doing?
the
Oh, yeah.
NIH guidelines panel have looked at that data and felt there's not sufficient evidence to say that it works or it doesn't. The WHO recommends strongly against it and suggests that it might actually be harmful. The NIH active studies are doing a whole bunch of studies with ivermectin as well as others to try and settle it once and for all to prevent people from taking it if it doesn't work, because it could be toxic.
Although I'm not a
So there's a
streamer now.
world
Don't
of
put me
difference
in that bubble.
between ivermectin and Paxlovid.
But this is a 40-year drug, and we're talking about one that's just now coming on the market. So we actually know that much about this Pfizer drug. I wish they'd come up with a lot easier names for their
Yeah,
drug.
they always do that. They
Yeah.
they fool me too with the names, Coach. But
Yeah.
it is what it is.
Fool me
the
too
fact
with the
is,
names.
I think it's kind of a miscomparison to say one is a 40-year drug and one is a drug that was just discovered. It was just discovered, but it was shown in a very well-controlled clinical trial to be highly effective. Even though ivermectin is a good drug for some parasites, it has not been shown in a well-controlled,
highly
placebo-controlled
effective.
trial to be effective in COVID.
Okay, thank you. Dr. Walensky, I don't know if anybody's asked this question. I just want to get cleared up. Our Supreme Court Justice last week, looking into the situation with the mandate, Justice Omar said there's 100,000 children that are sick as we speak with Omicron, and a lot of them are serious in hospital. Is that true or false?
I don't have the number of children in the hospital right now. It's likely less than 100,000.
Yeah, and Justice Breyer said that, you know, that if we continue to delay this ruling, that we're going to have 750,000 more that are not vaccinated infected a day. I mean, does that make sense to you?
What I can tell you is our children between the ages of 0 and 4 are one of the only places where our hospitalization rates are currently rising, and that children who are in the hospital are generally unvaccinated, not uniformly, but generally unvaccinated. And that's true for not just our 0 to 4 who are obviously ineligible, but also true for our 5 to 11-year-olds as well as our 12 to 17-year-olds.
Thank you. Well, thank y'all for being here
Babe,
today.
can you
Thank
hand
you
me
very
that
much.
number
Thank
two
you, Madam
cookie
Chair.
cutter?
Thank you so much. I have
In
one
that
final
plastic
question
lid
for
right
Ms.
there?
O'Connell, Dr. Walensky.
Yeah.
And that's
That
regarding
thing.
education. In the past, we have seen
Thank you.
school districts that serve a significant number of students of color or those in low-income or rural areas that are facing great challenges in accessing resources they need to serve our students. How is the federal government working
Maybe I
now
should
to make
just
sure
buy
that states
this
are equitably distributing tests and necessary resources like masks to all school districts, particularly those that serve predominantly students from families with low income, students of color, or rural students? And Ms. O'Connell, I'll start with you.
Thank you, Chair Murray. Equity is woven into all of the work that we're doing in this response. It's something that we are remain focused on, including making sure that schools across all states are able to access the tools and resources they need. We gave $10 billion, as you know, from the American Rescue Plan for schools to be able to set up their funding programs. We're also testing programs. We've also made it possible through Operation Expanded Testing, which Dr. Walensky can talk more about, where we have regional hubs where schools can contract directly with labs to run their programs for them. That was designed for schools that might not otherwise have resources to be able to manage a testing program on their own. In addition, we're making tests available through the federally qualified health centers and rural health
I
centers.
like how everything they're saying is, we're going to do this, we're going to do this.
In the year.
Do it now. Do it now.
Yeah, and maybe I'll just pick up exactly where Asper O'Connell has put down. So,
They're not finna do shit.
We'll be
our
proactive,
program,
not
our Increased
reactive,
Community
and that's
Access
what
to
we're
Testing
doing.
program does
We did
place
this,
tests
and
in
we did
pharmacies
that,
and
and we're
socially
planning on putting more tests
social
out.
vulnerability indices that are
Apparently we
high.
did.
That's
I
by
want to see
design.
it.
Tests in
Waldo said
federally
your ass
qualified
should be
healthcare
streaming the
centers and
bacon.
community centers, just as
I told her.
the Assistant
Tell
Secretary
her, Waldo.
mentioned. We also
No.
continue to support
Yes,
screening
sir.
tests at no
No.
cost to child care
I don't like
centers,
people
K-12 schools, and congregate settings through exactly the program that the Asper mentioned, Operation Expanded Testing. We prioritize high schools that have, and all schools that
Guys,
have
our
high social
priority.
vulnerability. And we have a website now that's active where you can enroll.
Okay, thank you. Senator Burr, I understand you have two additional questions.
This is fucking
Madam Chair.
not
This is for Dr. Woodcock and Ms.
24.
O'Connell. It's my understanding that prior to Omicron, BARDA informed some therapeutic manufacturers that they would no longer be supporting additional work on new therapies because there's no longer an unmet need, which may impact whether and how FDA prioritizes reviewing such therapies. Did
All right, it's all
BARDA
you.
and FDA change
Thanks.
course on this policy once the Omicron
Bang.
variant was discovered in November?
I'm done.
BARDA's decision to put that
Tis you,
notification
tis
out
you.
was in light of the
Thanks,
fact
you're a
that
real one.
therapeutics development was moved over to Operation Warp
Thank
Speed,
you.
and BARDA was
Something later.
supporting the therapies that were being developed through the Warp Speed effort. So it was a way of combining the funding that was available to be able to move the therapies through faster. BARDA never stopped supporting therapy work, but I'll let Dr. Woodcock.
Yeah, there is, we still regard there is an extreme unmet medical need for therapeutics at most stages of the disease, particularly the late stages where we still don't have interventions, and so people are dying in the late stage of disease, getting into the ICU, going on the ventilator. So of course, we have 670 INDs that we've been, clinical protocols that are ongoing, to my knowledge. So their robust development is still ongoing in the therapeutic area.
So how much funding has BARDA allocated to therapeutics this year, and how much is left to spend?
I'll have to go back and check that on the actual development. We've spent a lot of funds this year on the procurement of the therapeutics that have already been developed, but be more than happy to bring that number to you and your staff.
And this is, I'm talking about the development end of it. Because there's a firm belief out there that BARDA went to the industry and said, we're not supporting this anymore. They didn't say this got moved over to Operation Warp Speed, which, by the way, doesn't exist anymore. But they said, BARDA said, we're not supporting therapeutics because there's not an unmet need. That's what the industry heard. I'd love for you to clarify that for me. Last thing, Dr. Woodcock, since we did discuss the point of care and at-home testing, I just happened to come up with a chart that FDA put out not long ago. So let me just, and you're probably familiar with it. One's molecular, one's antigen, and one's serology. And for the molecular and the antigen, if you test yes for point of care or at home, that kicks you to the right. The next box is high manufacturing capacity. If your answer is no there, it kicks you down to an FDA intends to decline box. There's no option. So if you're not a high manufacturing test, then FDA is going to decline to review. Boy, I got to tell you, I think this is a huge mistake. Now, if you tell me that you've got a couple hundred tests that fall into the high manufacturing capacity right now at the FDA, where you've got the luxury of being able to kick out new innovative companies that haven't solved their manufacturing yet, by all means, tell me that's the case, that there are a couple hundred. Right now, Ms. O'Connell's struggling to buy 500 million tests. We're 47, maybe 50 million there. That leaves another 450 million to purchase. And we're going to distributors trying to buy their inventory, not to manufacturers trying to buy their capacity. Something's not right here, guys, on testing. And I will tell you, the current administration's chief of staff got it right in 2020, March, and he said, testing's broken, testing's broken, testing's broken. I just say to all of you right now, testing's broken. And Ms. O'Connell, I think the responsibility falls to the ASPR. I wrote the law. If, in the case of CDC, they were the delay to begin with, but to acquire testing, that falls in your lane. And I, for the life of me, can't figure out after $82 billion, except for somebody sitting down and saying, well, we just don't need those tests. We don't need to buy them. How you could let Abbott close 2 lines because there wasn't any business. These are some of the most premier manufacturers in the world that we've let get out of the mass manufacturing of home test business. If I'm wrong, tell me I am. I respect all 4 of you in a huge way. But I also express my disapproval very quickly, and that's what I'm doing today. Anything you want to add to that, Ms. O'Connell?
Please, thank you, Ranking Member Burr. Let me just clarify, of course, that the initial contracts you're speaking of towards the $500 million were the available inventory that these distributors had. These are the distributor contracts. The manufacturer contracts are currently being worked. You will see that capacity come on quickly. We just haven't been able to land the contracts, to draft the contracts as quickly as the distributors, but they are coming.
My suggestion in the future is that when you guys huddle inside the COVID team, try to get the administration to refrain from making these proclamations until we've got the product, until we know who we're negotiating with. We're now 3 weeks since the president said we're going to buy 500 million tests. We have 50 million currently contracted. I don't know how long it's going to take to get the rest of the contracts. This is not dissimilar to when we went out and said we're going to booster everybody in America, yet we rolled it out with just people over 60 to start with, and then we started moving down. And now we're begging people to get boosted, which is where we should have been on day one because we had the product available. But listen, you guys have a tough job. And I don't know of anything else Congress can do than try to create the statutory framework that you can work in to do your job, which exists, or provide the funding to allow you to acquire. Those are the only 2 things we can do other than bitch and gripe when it doesn't happen as quickly as we'd like. But Tony, I really respect you, and I'm sorry you and your family are going through what you're going through. But please understand, we go through that every time we go home with millions of people in North Carolina, millions that believe the bad information that's out there, millions of people that have a loved one in the hospital, but there's no monoclonals for them to take. Millions of people who are unvaccinated, probably wish today they had gotten vaccinated, probably wish they had gotten boosted, but they're now in the ICU and their wife or husband or daughter is calling us and saying, what do I do? So we're here to support. What you need, tell us. But don't think that we're just going to sit here and print money without a full accountability of where it has gone. And I hope the Secretary is listening to that conversation today. Senator Blunt and I said, give us a full audited accounting of the $82 billion and we'll entertain additional funding for testing. That was 10 days ago. I'm not sure when we're going to get it or if we're going to get it, but it's conditional. And this is the most powerful person on the other side of the appropriations, and I think she knows I'm serious on this one. There's got to be accountability on the money and the way it's spent. Thank you for being here. Thank you, Madam Chairman.
Thank you. I want to truly thank all of our witnesses today, Dr. Walensky, Dr. Fauci, Dr. Woodcock, Assistant Secretary O'Connell. We all know this is a very difficult, challenging, changing time, and you've all been through it for a long time. And I think you do understand the frustration. I'm sure you all have it as well as where we are. We all want to find solutions, and we stand at your back to be able to provide those. But thank you so much for answering all our questions. This is really an important conversation about the threat of the new COVID variant, or whatever the next one is, and about the path forward for our pandemic response. And we really do appreciate all the work you and all the people in your agencies do. So for any senators who wish to ask additional questions, questions for the record will be due in 10 business days, January 26th at 5 p.m. And with that, the committee does stand adjourned.
Oh, I thought she was about to take off her mask. Fucking shit show. Alright, ladies and gentlemen, that concludes our fucking podcast for the day. Another fucking shit show in DC.